Hi there. So today we're going to talk about how we refer to people who happen to be our patients trying to lose weight. So let me tell you about a story about my experience. Back when I was a resident, it was very typical for people to walk into a room as doctors, and prior to walking in, the description was this patient, room number 10, diabetic patients having problems with kidneys. Nobody used the name of the patient. We would go in, see the patient, say hello, examine them, make our plans for the day, and move out. Now, the problem is obvious. All these people were turned into a number and a disease. These were not being seen as human beings. Now, clearly, that's wrong, and we all know it. And one of the typical things we see and have seen is people with obesity being called the obese patient. So doctors typically, when they look at their schedule and somebody asks, so who's the patient? Oh, it's an obese patient who's here interested in losing weight. I think we can do better than that. So let me tell you about one of my patients. I recently saw a patient. She came to me very upset, a little scared, and she was just describing her experience with the medical health system. She was frustrated. People always treated her as if the disease with her, not the other way around, that she had a disease. And as we spoke, I began to recognize just how crucial it is to refer to a human being as a human being and then to address the disease that they're there to treat. And one of the problems with people being referred to as their disease is that over time, it begins to really sink in and you begin to see yourself as your disease. And it does cause psychological stress. That's why a lot of people that are overweight, they're afraid to go see a doctor, not because they're going to get needles or anything of that nature. They just don't want to be reminded of the fact that they're obese. So what happens is over the years, all those hurtful comments, that feeling and the obvious feeling that people are judging you and also just looking down on you and those stares, it begins to take a toll on a person, especially psychologically. So now there is some good news. It took a long time, but finally, the medical community, not just the doctors, but the whole medical community is beginning to appreciate that we can and actually we must do better. So we use what's called person first language. So we refer to the person, Miss Jones, Molly, and then we can fill in with the disease. Miss Jones, who has diabetes. Molly, who has severe heartburn. Bob, who is dealing with obesity. That way, in our minds, this is now a human being who's coming for treatment, not a disease who happens to be attached to a human being. And the important thing is this kind of change in terms of what we say, both to the patient and to ourselves, that is the beginning of a more wholesome and quality way of interacting with a human being. It also helps that the person will now have more motivation and pursuing their treatment because they feel like the doctor and them are working as a team, as opposed to the doctor talking down to them saying, you're going to do this, you're going to do that. That's not the right way to do it. And as mentioned earlier, the problem with calling people by their disease first and then the actual human being is they begin to feel stigmatized, afraid of the healthcare system, and just begin to look down upon themselves. When healthcare professionals begin to talk appropriately and more compassionately to a human being, it's amazing how that person begins to feel empowered to actually do something for themselves. They see us as doctors, nurse practitioners, they see us now as partners in this journey, as opposed to people that are there to judge them and to wag the finger that this month you gained 5 pounds. What's wrong with you? You're not doing well. That simply is very negative, and it doesn't help anyone, especially the person who's trying to lose weight in a healthy way. So remember, it's really up to us, the medical community, to treat you with the respect you deserve. And so you have to know you don't have to put up with this. If you're being treated by a healthcare professional, a doctor who you feel is speaking down to you or judging you or making comments such as, oh, you're using medication for weight loss, I don't want you to do that. That's really cheating. That's not going to help. And you're not doing it the natural way. You have to exercise more. You need to eat less. You don't need medication. You don't need bariatric surgery. That's really a sign of someone that's judging you, someone that doesn't understand your disease, and someone that's not likely to give you legitimate options for getting better. So at the end of the day, please understand you are you. Your disease is something that you have. A quality, empathetic, compassionate healthcare professional will see you for who you are and will do everything they can in their power to help you get healthy and achieve your goal. And if that's not who you're dealing with, at that point, talk with your feet. Get up, leave, consider finding another doctor. That is a good way to feel healthier, happier, and achieve your goal. Thank you.